Hi everyone, welcome to our first virtual class. We are very lucky today. We have Dr. Doug Wiebe here to talk about geography and health and how to integrate geography into our health-related research and interventions. And hopefully some of you can take some of the lessons learned today and apply it to the problems that you're working on. How does that sound, Dr. Wiebe?
Terrific. Thanks for having me, Sarah.
You're welcome, and I'm going to call you Doug from now on. Is that okay?
Of course.
Great. Okay, before we get started, can you tell us a little bit about yourself and your trajectory?
Yeah, sure. Did a PhD in social ecology, which is the study of the interaction between people and their environment. While I was doing that, I learned about the field of epidemiology and public health and was motivated to work on prevention of injuries based on some earlier work that I had done. So I did a postdoctoral fellowship in injury prevention at UCLA and then really got interested in the methods of epidemiology and injury prevention and public health. And I've combined those two for a career and now work at the University of Pennsylvania. I'm a professor of epidemiology and I study geography and health with a focus on injury prevention.
Great. Well, tell us what's important to know about geography and health.
Well, ultimately what's important is that place matters. Place matters profoundly for our health, ranging with everything from diet to risk of being injured. Place also matters for prevention. If we change places, it can be much more efficient from a public health perspective to make places safer than trying to get people to change their behavior.
Got it.
To either eat more healthy or to prevent them from driving recklessly. If we can make structural changes to places and objects, we greatly can increase our potential to improve health.
Okay, great. So, we've been talking a bit in this class and pulling from examples around some of your work in gun violence. And indeed, with your research, place did matter. Can you talk a little bit about that as an example?
Yeah, and a good example is that, like, from the micro to the macro, place really matters. As I was doing my dissertation research, I learned about one study published in the New England Journal of Medicine, finding that if you have a gun in the home, you're more likely to die by homicide and suicide than people without a gun in the home. And there are important injury prevention policy implications for that. But it's also just one small little piece of the dynamic that can be happening in the home. Understanding a contemporary example and innovative in Philadelphia is that recently a randomized trial was completed here where vacant lots were greened with the goal of reducing gun violence, and in fact they seem to have reduced the incidence of gun violence nearby. And there's even kind of a biological mechanism and understanding a framework behind why that could be happening. Great.
So let's start talking a little bit about mapping and spatial analysis.
Yeah, great. So a map is an extremely complex piece of information, and mapping can have a lot of value, for example, in reaching policymakers and presenting graphically the phenomenon that you're wanting to try to describe. If maps are done wrong, they can be confusing. If maps are done deliberately wrong, they can be very misleading. And there are a couple of simple principles to think about when we present information graphically on graphs and also on maps. So let me tell you where I'm coming from on that. Edward Tufte at MIT has now become famous for his work on data visualization. And he has this nice principle about the data-ink ratio. And he says, is in anything graphic, try to only have ink that communicates data. Like, do not be wasteful in what you put on that background in that piece of paper. And so let me give you an example of what it's like to be very efficient in graphing data. Have a look on the left. This is a bar graph, obviously. Percentage of adolescents who smoke in England, 1974-1994. And you can see how this is arrayed to try to communicate a main message. And this is a good example of how um, the ink is not being used efficiently. Look at all the redundancy in here. A bar graph, very wide. Moreover, a bar graph colored black, that's literally a lot of ink, with guidelines going sideways to show you the percent at any given height above the graph, is redundant relative to the numbers here above each bar, showing what the percentage is. Each of these percentages is listed here 6 times above the bars. The percent is here every time, and even a background is shaded gray, so that's a lot of ink. And a much more efficient way to communicate the same information is this one on the right. This is just a much more efficient use of the data ink ratio.
Great.
And so that's a graph, and we can think literally about the same concepts in mapping. And a great example for our class here in public health is, of course, the Broad Street pump. And you'll be familiar with, this is the classic map where John Snow in the Soho area of London, circa, I think, 1850, mapped the incidence of cholera by stacking little bars on each home according to where deaths had occurred. And there's a lot of information on this map that makes it hard to grasp the punchline, which was his finding that more deaths seem to be happening near this one particular pump than elsewhere.
Let's try an activity where I'd like you to take a look at this map. This is John Snow's initial map with the cholera outbreak, and pause the video, look at the slide, and consider how much ink can be removed without loss of information.
I like your question. How much ink could be removed to better communicate the key finding that John Snow brought back to the policymakers?
We'll see on the discussion some of the ideas that you all came up with, and then do you want to talk about how the ink was removed to make this a little bit more clear?
Sure. It probably jumps out at you. Many of the small streets have been taken off because they weren't what matters. Broad Street is now one of the few streets that actually has a name on it, because that's where it mattered. We have larger X's to indicate where the few pumps were, and it's just easier to see visually that this is where the dots are stacked most heavily relative to other parts of this map. So this is a big improvement from the first original map. And you could do even better.
Yeah.
And it would be neat to put it back to the class. How might we even more efficiently communicate that there's one pump in the middle is this thing, and that is the epicenter of this cluster of cholera cases. And you know, if you blur your eyes, you can almost see it get thicker in the middle there. And a way to have that emerge for us empirically is to lay out a heat map. And when you put down a heat map, it's just another word for density. And now each area is coded according to density, the number of cases per home. And you can see red means higher, and red is right on top of the Broad Street pump. So that's a way to communicate information more efficiently than John Snow did in the first case, and 150 years after his first work, when we've been thinking a lot about how to communicate information visually to carry a message.
Great. Okay, and I know that's really important with what's going on now with COVID-19. I know Hopkins has a site, which I'll post up, where you can see where outbreaks are occurring visually on a map. And I see you have a map coming up in your next slide. Do you want to?
Sure. Here's another map. Here's another example of describing findings in geography and health, and that emphasis is how much we have to be careful to be clear on what the message is. This was published in JAMA, and one takeaway from this map is that 25% of the U.S. geography can access a trauma center in an hour. And there's this phenomenon in trauma care, we talk about the golden hour. And if you are traumatically injured, you have a much better chance of surviving if you get delivered to a trauma center within an hour. So we hope that we can all do that. The way that this is described is only 25% of the geography of the United States is within one of those red blobs, which is where you have 1 hour access to a trauma center. So the message, 25% of the geography can access a trauma center in 1 hour. It's really like only 25% of the US geography, which really sounds like bad news. But the findings here are really good news. And the finding actually is that 85% of the US population can access a trauma center in 1 hour. Of course, it's the case that most people in the United States live in one of the red areas. So if this is good news and not bad news, it's just a very simple, different way of describing the finding that made all the difference.
Yeah. Huh.
It was Mark Twain who said the difference between the lightning bug. Oh, I lost it.
Oh.
But it's a good one.
Oh, good. When we put things on a map, are there simple principles of how that's done?
Oh, sure. Yeah, when we put, when we display data graphically, yeah, simply put, we can map points or lines or polygons. It all boils down to that. Points, like places where cholera occurred. Lines, those are roads, and polygons, census tracts. And if data are in one of those three forms, we say that they are vector data.
Okay.
There is a different way, a fourth way to communicate data, and it is with raster. And that means you lay down a pixel and you color the pixels according to what you're seeing. And GIS software lets us layer points on lines, on polygons, and then on pixels to bring data together geographically. And so GIS software is very powerful and designed to do so, to say for any given place, here's the context and here's what's here, demonstrated with different types of layers that are all data.
Great. And there's a principle I've heard of ecological fallacy. Can you talk a little bit about that?
Yeah, people may know the example from Durkheim about ecologic fallacy, looking at suicide and Catholics and Protestants. And the problem with measuring phenomena in places is that if you're not measuring the exposure-disease relationship at the individual level, the person who gets exposed and the person who has an health outcome, you may interpret the findings incorrectly. So if our unit of analysis is place instead of person, we're subject to the ecologic fallacy. And here's an example of that. It may be the case that in 3 different cities, the percent of people who are the likelihood of having bad health is higher in people who are unemployed. And that is communicated here and here and here in each of those cities. As the percent of unemployment goes up, it's a positive relationship with the percent of people who have bad health. If you're not measuring that phenomenon within people and only within places, you may find this. You may find a downward slope. That makes it suggest that in places where there's more unemployment, ill health is lower. So that would be the finding if we were only analyzing something at the group level, when in fact what's going on with health at the individual level is a positive relationship. So if we work with data in places, we are at risk of the ecologic fallacy. Um, so working at the group level takes us to thinking about study design and why doing an analysis at the group level is inherently subject to more bias than conducting a study at the individual level. So let's think about epidemiology for a minute, which is all about study design. Much of the work done in geography and health is done at the ecologic level, looking at places and relationships between exposure and disease at the population level rather than the individual level. These different types of study designs, going up all the way to a randomized trial, are ranked in order from highest to lowest ability to test a causal hypothesis. So if you're doing work at the group level, in general, you have a low potential to test a causal hypothesis. When we study geography and health, we can actually use each of these types of study designs. By no means is everything conducted at the ecologic level just because it's a study of geography and health. One reason that we want to use a higher level of study design is because the potential to impact policy with our evidence is higher as we use study designs further up on that list. So an example of conducting a case control study in the context of geography and health is this really classic question: are you more likely to have brain cancer if you live close to high tension power lines than further away? And if we only looked at people with brain cancer and took a sample of 100 people, these are cases, and looked at whether or not they live near power lines, we may find that the majority of them did. If we make a conclusion off that, we might be wrong. This is really just a case series, and a lot of people with brain cancer live near high tension power lines. Of course, what we need to do is bring in a control group, individuals without brain cancer. If we also enrolled 100 individuals without brain cancer, and we found that 80% live near power lines, that would suggest that living near power lines is protective, with an odds ratio of 0.4. Now, that hasn't been the case in the studies that have been done. It may be something more like this. Among people without brain cancer, 80% of them do not live near power lines, suggesting that, in fact, living near power lines is associated with a risk of brain cancer. So that's another study of geography and health with a much stronger study design. Let me end with one of the strongest study designs, a randomized trial that was conducted in Philadelphia. And this is led by Charlie Branis, who directs the Urban Health Lab and is now chair of epidemiology at Columbia. And they had funding from the National Institutes of Health to work with the Pennsylvania Horticultural Society and randomly selected vacant lots from across the city and greened them, took out the trash, put in green grass, planted a tree, put a white picket fence around it with an opening so people could use that space. And bottom line is that they found over a number of years, places that had been greened came to have a lower rate of gun violence than places that haven't been greened. And that's actually been widely covered in the press now, and people in class may have even heard of that work. So that's a very strong study design working in geography and health. And Sarah, if I can just end with this one.
Yeah.
So, why place matters. A classic example in public health is thinking about global health and malaria, and how we can be much more efficient in managing malaria if, instead of expecting the local community to regularly apply larvicide, if we can just drain the brackish ponds and not give mosquitoes a breeding place to live. And we can think in the same ways when we think about injury risks and public health. And it boils down to this: the lower on this pyramid where we can make changes, the more likely we are to impact many people.
And they've seen this health impact pyramid and are starting to think about how to create interventions with a wider population impact. So, places would fall in that sweet spot of changing the context. Great. Well, let's thank Dr. Weed join us today talking about geography and health. And now we're going to move to an activity known as Haddon's Matrix that can be used to address some of these population level problems that we're looking at in all of your groups.